This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
And welcome to Dr. Tom Roselle Live. We are live in studio here in WMAL, and we're here to take your questions you've tried and applied. And we've got more information for you like we do every single week. As you tell, Dr. Roselle is out of town, so this is Stephanie Pina. I'm filling in for him. And we have a great topic today, one that's near and dear to my heart. We're going to educate you on something that we get a lot of questions of in the office. We get a lot of questions around the state. But the good thing is it definitely keeps on track on getting you more up to date with your health, getting you to pay attention to that self-healing and taking responsibility as well, too. So we are going to talk about what is naturopathic medicine. And live in studio with me today, I actually have two members of the Virginia Association of Naturopathic Physicians. So like myself, they are naturopathic physicians practicing here in Virginia. And I'm going to go ahead and let them introduce themselves.
Hi there. Thanks so much, Stephanie, for having us on the show, and to Dr. Roselle as well. My name is Sarah Giardenelli. I'm a naturopathic doctor and acupuncturist. I've been here practicing in Northern Virginia for about 5 years, and my practice focus is on chronic disease and general medicine.
Good morning. Thank you, Stephanie, for that introduction, and Dr. Roselle. My name is Patricia Diefenbach. I'm a naturopathic physician and a certified nutrition specialist. I've been working in Virginia since 2014, and I'm an active member of the VAANP and the District of Columbia Association.
Great. And so what's great about this is you have the people that are actively involved with the naturopathic practice here in Virginia. And we're going to talk about the differences of, not only what is naturopathic medicine, but who do we treat, what do we do, and the specialties really that separate out why people should really see a naturopathic physician as part of their healthcare as well, too. The AMP, which is the American Association of Naturopathic Physicians, kind of defines naturopathic medicine as a distinctive primary care health profession emphasizing prevention, treatment, and optimal health through the use of therapeutic methods and substances that encourages individuals' inherent self-healing process. The process of naturopathic medicine includes modern, traditional, scientific, and empirical methods. So that definition is great, but it probably leaves people just as curious as what the heck does that mean? So I'm going to ask one of you two, what does naturopathic medicine mean to you? And, how do people get involved with this? How do people get interested enough to go into school and want to learn this when you have, conventional medicine options, you have a lot of other holistic medicine options? Why naturopathic medicine and why now?
That's a great question. I personally see in my practice every day that people are really looking to optimize their overall health using least invasive means and using a natural medicine approach where they're trying to find answers to why they're not feeling well, as opposed to trying to mask symptoms with pharmaceuticals and such. And, I think one of the best ways to understand how people get into wanting to get help from a naturopathic doctor is, even vis-a-vis my own personal story, which is as somebody who has suffered with all sorts of food allergies and sensitivities and related digestive issues for years, and trying to figure out the underlying root cause of what was going on. It was really through a naturopathic approach that I was able to get to some digestive healing and then subsequent, healing overall with my overall health. And that this was over many years. And the naturopathic approach of trying to really uncover the underlying root cause of these issues that I was having led me back to optimal health.
What, Patricia?
Yes, well, I grew up overseas, and so the approach to medicine in the countries that I lived in was also very holistic, so that was what I was accustomed to. And then when I moved to the United States, I developed all kinds of food sensitivities and environmental sensitivities, and I went to multiple physicians, and nobody really could find what was quite wrong. And then terms like fibromyalgia and chronic fatigue were tossed about, but nobody was quite sure. And so I did a certain amount of research, and I started finding alternative routes like acupuncture and chiropractic and certain botanicals and nutritional supplements, and then lifestyle changes. And over a period of 10 years, I was able to recapture and regain my health. So that I decided then, wow, there are other people out there like me. I would like to be able to help them as well. So I went off to naturopathic medical school then.
I think what we're seeing more and more people, just like when you're listening to the show here, is they're looking for that information. They just don't know where to go to next. They can only do so much online, and you hear, this is the supplement of the day, and this is the test of the day, and the diagnosis of the day. But do I have this? Who can I trust that's going to be able to incorporate my overall health overall? And, that's what I think naturopathic medicine, and one of the reasons why I got into it as well, too, is that it did give you a chance to combine a lot of the information on the Western medicine side, take what we know, what we can research, and then also kind of use some of these old traditional techniques that really just stimulate the body to start to heal on its own. So it's not so reliable on drugs and surgery, and really kind of addressing both, the biochemical, the structural, the mental, emotional, just like we talk about all the time on this show. As we're talking about this, if you have any questions, you can feel free to give us a call here in the studio. That number is 1-888-630-9625. Again, that's 1-888-630-9625. And we're discussing naturopathic medicine today. Let's talk about a little bit of who comes to a naturopath. Who are the people that are seeking the advice of naturopath? Because certainly there's a lot of different options out there, and we're going to get into what's different between a naturopath and a homeopath and a chiropractor and an acupuncturist, because just even this room, you're looking at, well, you can't look at us. You can hear 3 different people that have additional training. We had to supplement what we were doing, because right now in Virginia's an unlicensed state, but DC and Maryland are, and it brings up the fact that people are coming to different providers looking for different information. Who are the people first coming into naturopathic offices that are really embracing what we do? And then we'll get into, how available it is around in the area as well.
So I'm getting a lot of calls from patients in particular who have chronic diseases like diabetes and heart disease, and they're on multiple medications and they're having all kinds of reactions. And they're actually at this point willing to make lifestyle changes. Naturopathic medicine does involve a lot of lifestyle changes. It's not just about taking one pill or a supplement. One has to be very mindful of what one is doing. I get a lot of clients and patients with fatigue. They don't understand why they're fatigued. They've run through all kinds of tests. So we have to start a foundation of how to recreate their wellness and optimal health. So that's what I've been doing, and it takes one step at a time. There is no quick fix. It does take patience and a little bit of time, but the focus is on biochemical individuality. So every person who comes to me has their own story and their own stressors and their own illnesses, and one size does not fit all.
This is Sarah Giardenelli. In my practice, I have, it runs a gamut. I work hand in hand with medical doctors and osteopathic doctors in a primary care clinic. And so many of the patients that I see are coming with heart disease, prediabetes, diabetes, high blood pressure. But then, most of these patients too are dealing with a lot of stress, sometimes anxiety, depression. Then I get another subset of patients who are really, really healthy and they want to maintain their health. And the wonderful thing is that naturopathic medicine has a lot to offer both these types of patients. And so it runs the gamut of people with multiple chronic health conditions and then really healthy people who want to stay healthy.
So we're seeing what's amazing, I think, about naturopathic medicine is that, like you mentioned, it is an individualized care. Like there is no one set pill that works for everyone. And really first identifying that root cause. And there are basic principles of naturopathic medicine that really help to tell you how this is different from conventional medicine or other types of holistic medicines. But one is, believing that healing power of nature, that the body has an innate ability to heal. And we need to help stimulate that. We're just the tools to get that to happen. Another one is, first do no harm. So apparently we want to start with the easiest and gentlest thing first and then kind of build up, because different naturopaths practice not only different specialties in who they see, but they may do botanical medicine, they may do homeopathy, they may do physical medicine like naturopathic manipulations, they may do nutrition. There's so much to offer. So we really have to have a hand in a lot of different training and a lot of different methods to go, what's going to work visually for this person. Can we speak briefly on what is the training of a naturopathic physician? And because no one really knows, what's out there and what is our training. And there's a lot of discrepancies of what is a naturopath to begin with. So.
Yeah, a licensed naturopathic doctor completes a standard medical curriculum in addition to clinical nutrition, homeopathic medicine, botanical medicine, psychology and counseling. These are all different areas, and it would be lifestyle counseling that are all part of a naturopathic education. So a naturopathic doctor completes a 4-year graduate level medical school education, and this includes all of the same basic sciences as a medical doctor, but also includes the holistic and approaches that I just mentioned, with a strong emphasis on disease prevention and optimizing health. And also a naturopathic doctor must pass professional board exams to be able to go into a regular practice.
And we're seeing more and more people also, get involved with larger centers. Like there's an oncology board as well that deals with the naturopaths could take a test for. Cancer Treatment Centers of America that you're seeing now, presented as this holistic approach. They have naturopaths on board since the very beginning, so they're really one of the breakthrough providers in there that really embraced what we do. You're also seeing essentially a lot of research done by naturopaths as well too. And, some of that research is coming down through NIH as well too, and one of their main directors is part of the research projects too. So they understand the type of medicine that we have to offer people. It's just getting it to people and for people to understand that really is embracing their overall health and not knowing that it's just one particular thing that's going to help and cure them, just like they didn't get there overnight usually. So there's a lot of different aspects of it. We're going to take a quick call before we go to a break here. Is that Allison? How can I help you? Lisa.
Hello.
Hello?
Hear me okay?
Yep, I can hear you. How can we help you?
So I've been suffering with one leg only, the doctor told me it was contact dermatitis, eczema. It was only my right leg from my knee down. At one time it was both legs, but my left leg's fine now. So it never heals. Like I'm always having this rash on it. One doctor told me maybe it was fungal. So I've tried all kinds of things. They put me on antibiotics before. On Keflex, I was on that twice because they said it was a staph infection. They put me on high-strength topical steroids, which I've used like pea-sized amounts, they say, when to put it on when it's bothering me.
All right. So we're going to hold on just a second, and then we're going to get to your rest of your question just when we get back from a break real quick. All right? Hold on.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
All right, we're back, and this is Stephanie Pina filling in for Dr. Tom Roselle live in the studio, and I have two guests from the Virginia Association of Naturopathic Medicine, and we're going to continue to answer this question on dermatitis. Caller, are you still there?
Yes.
All right. I'm going to send it over to one of the naturopaths, and let's go from there.
Yes, this is Patricia Diefenbach speaking. The The skin is another one of our body's organs. So if we're not processing toxins and food properly, it's going to express itself in multiple ways, and one of those ways is the skin. So it would be important to look at your digestive system and your liver as to how it is processing what you're eating and what you're absorbing from the environment.
You know, one of the things, too, I think you had mentioned that in the past they had given you different types of antibiotics, and was it making it any worse, or was it about the same?
Sometimes it makes it better. I don't think really worse, but it never has healed, and this has been for years only on one side. So it's just, I mean, I'm not getting any answers from any doctors. And
right.
Kind of like.
Right. So what's the interesting thing about this is, you know, obviously when you're using a topical antibiotic, like, and it's not really making any changes, it kind of tells you it's more of a systemic effect and it's not just localized to that particular area. And unfortunately, that's the way it's treating. So we were just talking about, you know, the liver and its detoxification processes. We have to really support that system because obviously something's trying to come out. It's not healing correctly. And that also could be in the digestive tract as too. You know, I mean, we have protective bacteria that also help us as well. So basically, what we want to do is really investigate a little bit further and look at the rest of the body, not just what's topically on the skin and try to treat it there. I mean, there's a lot of different things we can do with different herbal washes, but if you can't treat the internal system and find out that initial source, it's probably going to keep returning. And that's why some of the things they've done in the past probably doesn't have been able to help you. So, but thank you for calling in. It's a great way to lead into a little bit of our next caller as well too. So people are calling in. Feel free, like I said, to give us a call, 888-630-9625. Mike from Chantilly, how can we help you?
Yeah, hi there. I've been diagnosed with alopecia areata, I believe it is, and I'm trying to figure what I could do to try to stop this baby because it's really going wild on me. I've lost pretty much all the hair on my head except, within the last 5 weeks.
What's happened in the last 5 weeks? It's increased or what's been going on?
It took 5 weeks to lose it all. Now it's slowed down because, frankly, I've got maybe about 100 hairs left.
Okay. Well, one of the interesting things about alopecia is there are a lot of different causes that can happen. It's just like when we were just our last question, when we were talking about the skin. I mean, basically that skin, that detoxification organ is helping the hair growth. And that's where the follicles are coming from. So a lot of the times we have to look at, is there an autoimmune response going on? So there's inflammation that's not allowing those hair follicles to grow properly so that basically as they get weaker and they would normally die out, they're just not growing back. Obviously, we have to look at the hormone system as well, too. You know, with men, we have to look at that balance of testosterone. How is the liver functioning that? Is it at the right properties? And then even in Chinese medicine, when we think about this, we think of blood flow. You know, if that blood flow can't get to the skin properly, it's certainly not going to support growth of smaller follicles, just like hair and nails and the skin. So there's a couple of different things kind of going on with this. Anyone else want to add anything?
I would say also to look at nutrients, although the sudden hair loss within, you said, I think, a month would lend me to thinking about another cause other than nutrients, which usually that's more insidious. You would see that kind of coming on slowly over time with slow hair loss, not quick hair loss. So, yeah, I think definitely looking at the hormones and looking at the immune system, having your thyroid evaluated, that would be important to follow up with your doctor on.
And I would also look at if you're taking any medications, if there are any particular side effects associated with those medications.
Yeah, and
I noticed that my blood pressure medication, it's a side effect, and so we switched medications for that. And then the other thing I was told was try taking biotin and minoxidil and see if that helps.
Well, the medications, you know, what's interesting when they came out with the medications for alopecia is it really kind of stopped hair growth where it already was. It wasn't necessarily helping produce more. The problem is you're adding more medication on top of more medication to treat those side effects. So we may need to kind of sit down and go, what if we treated the blood pressure to begin with so you weren't on the medications that were creating this? And don't forget that, you know, with hair growth, basically it's going to take some time to grow back too. So your body has to go through that whole process of kind of this old hair dying out in order to regrow it again too. So basically you're starting at day one almost every single day. So I would say look at some of the medications and, you know, see if we can find more natural ways to kind of address those underlying causes like the blood pressure so that we don't have to keep building more medications on there. But excellent question, and it's a great way to look at the whole body as well too. When we get back from the Dr. Tom Roselle's live show, we're going to talk some more about the naturopathic principles, such as doctor as teacher and treat the whole person. And the best is going to be preventive medicine and what you can do. We're live here in studio. We'll see you in just a moment.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to Dr. Tom Roselle Live. This is Stephanie Pina. I am in-house today live with two guests, and you are listening to us to see if you can try and apply and get your questions answered, and basically find out if there are natural solutions and options for you. And naturopathic medicine, you know, near and dear to my heart. I practice with it along with acupuncture. And what we really can provide to the world is, you know, what has become the hot, trendy word in the conventional community is functional medicine. How does the body function at its best? It's not anymore about within your normal limits, because you need to function better. So, you know, we see this when doctors now take lab tests and they kind of say, well, you're normal, but you're going, I don't feel normal. That's not functioning normally. So naturopathic medicine was originally the original functional medicine providers. And, you know, 100, 200 years ago, we didn't have access to antibiotics and lab testing and imaging that we did now. So we had to use the power of observation. We had to sit down and actually talk to the person. So naturopaths are really well known to basically providing that increased information to them and finding out what's really wrong and getting to the root cause of everything that's going on. Let's talk a little bit more about a couple of the principles, and then we're going to get into a survey that actually talks about using naturopathic medicine along with the VA. But doctor as teacher is a very important one, and no more so than what we do here on the radio show. But that's really one of the important principles, because if you can't teach someone about their health, you really can't go forward, because they need to know why they're making the changes. If you know why you're doing something, you're going to be more willing to make it. Tell me a little bit more about how that expresses not only from a naturopathic physician to their patient, but how does that also go across from an advocate of naturopathic medicine out to the public? How do you have to be a doctor as teacher to the world, essentially, about the type of medicine that you use, as well as when you're in the clinic and one-on-one with people?
Great question. So in the clinic, that's, the easier answer, I would say, because you're working with patients every day who want to know why they're feeling the way they're feeling. And so it's a wonderful opportunity when you are able to uncover things in their lifestyle or otherwise in their physiology that are contributing to how they're feeling, to be able to teach them, why I'm making the recommendations I've made. And, every day I hear patients say, if I can understand why you're making the recommendation, I'm going to be able to be compliant with that recommendation. And it's really cool to be able to interact with patients at that level to see their lives change really because of it. And that's why I do what I do. And then as somebody who's really intimately involved in my profession on a state level, as a vice president for the Virginia Association of Naturopathic Physicians, I have the opportunity to engage all the time in forums like this and talking with legislators and talking with the general public about what naturopathic medicine is. Certainly on the West Coast, it's a lot more familiar of a term, which is really interesting since naturopathic medicine arose on the East Coast. So it's a re-emerging profession, and certainly, as you indicated, there's a lot of interest even now, stemming from the Veterans Association administration having some interest in naturopathic medicine, and the general public every day, VAMP, the Virginia Association, is getting emails and queries on how could naturopathic medicine help with X condition or Y condition, or help me optimize my overall health.
Yes, and I would say with the patients and clients that I have, I spend a great deal of time explaining everything, how it works, why it works, and the compliance is far greater when they do that. And they a lot of the time I do spend a great deal of time explaining what stress does to the body, because living in the Northern Virginia area, everybody's in a pressure cooker, be it on the Beltway or be it assimilating your children's schedule or running off to meetings. So the root of our health lies in our digestive system, and if we're eating our meals sitting in our car or looking at the emails while we're at work, we're not relaxed. We're not in the relaxed state of being that we need to be to actually process the nutrients that we're eating. So even if you are eating healthy organic foods, if you're stressed, your body's not really absorbing them. So, as I say, I do spend a lot of time explaining the pitfalls of stress and the negative side effects of stress.
Absolutely. So currently, right now, there are 18 states, I believe, that are licensed as have licensed naturopathic scopes of practice. There are actually 7 schools, so when I get out, there was only 4, so it's an increasing field for sure. The demand of students going into those schools, whether they're coming from other medical backgrounds, are certainly increasing as well too. And then what they're coming out and doing is the job opportunities, working with other MDs, working with other healthcare providers certainly help a lot to help grow the profession as well too. Now we mentioned the VA and the acupuncture. The American Association of Naturopathic Physicians actually did an info survey that went to veterans, and what they did is they were trying to see veterans' view on naturopathic physicians in the use of the VA, and they actually surveyed 401 individuals in the spring of 2015, and their results were actually really interesting because we know that the VA, while it offers a great source of health for veterans, there's always more that we can do to improve it, and we know that that population is actually increasing. And when they asked them about natural therapies and naturopathic medicine, nearly 2/3 of the veterans, so 64%, would prefer to see a doctor who prescribes natural therapies before considering drugs and surgery. And they also basically would consider seeing a naturopath, 73% of them, basically if they were nearby. And more than 12% of those people would be willing to travel over 50 miles if there was a naturopath nearby. And one of the main reasons is why they were interested in the natural therapies, they were interested in non-invasive therapies, but they also the fact that naturopaths tend to spend more time with their patients than conventional doctors. So this survey result actually showed quite a bit of interest, and that was not just with those under the age of 50, but over the age of 50s as well, too. Under the age of 50, 86% was interested in seeing naturopaths, and 69% over the age of 50 were interested in seeing a naturopath and receiving this type of treatment. And like I said, that can include looking at things such as diagnostics, like clinical and laboratory diagnosis or lab work, nutritional medicine, botanical medicine, patient counseling. In some states, it can include acupuncture and minor medicine. Prescription medications are sometimes covered, IV injections, and even naturopathic obstetrics like childbirth and midwifery. So each state that we talked about of those 18 have their own scope of practice and really can deem what those naturopaths can do, but they can work by themselves or along with other practitioners. So it really is showing you the scope that the naturopath could be that next preventive medicine doctor and really embrace the true definition of preventive medicine instead of it being screenings and surveys and injections and immunizations, really going, how do we get involved with stopping disease and inflammation and adrenal stress before it has to happen as well, too?
Yes, Stephanie, I'd just like to add that I am an Air Force wife and helping the servicemen and women of our country who have dedicated their lives and made a huge commitment is near and dear to my heart. So I would really like to see that naturopathic medicine is embraced by the VA because we can really help them.
We know we're seeing more interest in it. Like I said, there's increased student involvement, and then we're also seeing more research done and where naturopaths are getting involved with other aspects as well as medicine. But what I think is interesting too, and I'm going to back to Sarah here for your story, because you really have to embrace working with conventional medicine and naturopathic medicine at the same time. And also as a dual naturopath and licensed acupuncturist like myself, you have to find that right balance between everything. How do you feel that works in the system, and how does it work for you?
Yes, I work in an integrative medicine clinic with we have about 20 primary care providers at the moment. And So it provides me a good even though I'm trained myself in primary care, the scope of practice, as you indicated, in Virginia does not lend to me practicing primary care. However, it allows me to practice a real complementary role to the patients, the care that these patients are receiving. So a lot of them are wanting kind of what they call, I just want somebody to take a look at everything. And so a lot of patients come to me wanting to get that bird's eye perspective, looking at everything related to their health, including all their lifestyle, and wanting that natural medicine approach. And I have that more time because I'm not having to manage their primary care. I'm not having to manage their annual screenings. I can work with them really on what's going on for them and to try and address those root cause and look at their lifestyle, look at their diet, their sleep habits, their stress, and how they're managing it or not managing it. And, help, work in conjunction with the doctors to evaluate their nutrient status and food sensitivities and these types of areas that do play such an important role in their overall health, and take the time with those patients and get to the solutions. And I think that's one of the key pieces. I have the luxury of time since I'm not having to, be that primary care point person and see a certain set number of patients per day. I have more time to sit with the patients and really try and figure out these different areas. And that's a beautiful thing, is to have that time with the patients.
So it's great when we have the training that Western medicine provides, the basic training, the pathology, the Western medicine diseases, and then that's combined. That's the important part, I think, that people don't understand. That is combined along with the natural remedies. And this is intense training in things, like I said, botanical medicine, nutrition. Why are these things working? This isn't just, I took a course over the weekend or an online course. The naturopathic physicians that are in these unlicensed states have 4-year doctorate degrees. So there's 3 doctorates sitting in here that basically, that's a lot of time and effort, and then you have to pass national board exams. So when you're seeing a naturopath, you need to know the education, what they're behind it, and certain naturopaths use certain types of skill sets more so than others. They sometimes will go more towards treating certain types of patient, like an oncology type of patient, fertility as well as a rising topic. So you're really starting to see this trend of the naturopath being that primary care filler in, we'll say, and go from there. Bernice from Tucson, in Arizona, where I had my naturopathic training and my acupuncture training. How can we help you?
Oh, hi. I have a friend that she's like 89, and she does pretty good, but her legs, sometimes she'll complain of her legs, just don't want to go. What could she do? She is on some vitamins, but what else could she do that might help her legs get stronger? What nutritional food or vitamin?
Has she seen anybody so far, like any, or talked to you at all about what she's been able to do so far that?
Well, nobody naturopathic, just Western medicine.
Oh, well, you're in a great state to see a naturopath. My number one thing would be go see a naturopath.
What do you recommend in Tucson?
There's a number in Tucson, actually. Just like the Virginia Association of Naturopathic Physicians, you can look up the Arizona Association of Naturopathic Physicians, and there are a number of people in Tucson. In fact, one of my classmates is in Tucson as well, too. So they're definitely spread around the state. And the good thing is that where we mentioned the scopes of practice being different in states, Arizona has an amazing scope of practice. Basically, they are primary care physicians, and they can actually prescribe medications when they need to. It's still not going to be the first avenue, but if they need to. So one of the things that they want to actually do is, you got to look at the musculature first. You got to look at the nervous system and what is it reacting to. If someone's having kind of leg movements, there can be a lot involved with it. So we have to see, is the nervous system malfunctioning? Is there cardiovascular issues so that the muscles are kind of trying to get more blood flow so that movement's actually circulating the blood for them? And also reviewing, any medications, any supplements, because not all supplements are great either. There can be side effects to that.
For her, like fish oil, it's called Omega XL. She does that.
Right. So there's probably, and that's probably going to help with general information, but it may not be specific enough. for her to do that. So she really should get in, especially if this has been going on for a while. She really should look up those local resources and really sit down and talk with them, because that may be an indicator of something else going on as well too. Because we want to treat the symptoms, but we want to treat that root cause as well, and get down to the issue. So she's got great resources around her. So I feel confident that if she gets with the right person, she'll get this taken care of. It brings us back to the question too. It's not just about that individual supplement. It's about how the body processes it and breaks it down. And is it the right form? Is it absorbable? So that's where a lot of this training kind of definitely takes into case. One of the other things that I want to talk about is the fact that we know that 33% of American adults use some form of complementary, alternative, or integrative medicine. And that was based off of an NIH study in 2015. So the more information they get, the better they're going to be able to know who to go to. Now, we get asked questions. They seem very basic, but this is a great opportunity to break this down as, not only what is naturopathic medicine, but what does it cover? Because a lot of people come in going, oh, well, you're a naturopath, or you're a homeopath, or you're an herbalist and stuff. Let's break down a little bit of the difference, because obviously I always say a naturopath can be all of that and include it, but at the same time, each one of those also have very specific ideas behind them as well, too.
So naturopathic doctors do get trained in homeopathy. That's one of the modalities we use. It's based on a concept of cures like, using a very minute amount of a substance to affect global change in the body. That's just one modality that some naturopathic doctors really embrace as a primary modality in their practice, and other naturopathic doctors may not use that as much. And then the osteopathic doctors, those are doctors that have their own types of medical schools, osteopathic medical schools, and they get trained very similar to medical doctors as the base of their training, but on top of that, they get more training in musculoskeletal approaches and manipulations called osteopathic manipulations. And then also we have herbalists, and those are folks that don't necessarily go to medical school, but are trained in primarily using plants as healers.
Well, when we come back in just the last break, we're going to keep talking about treating the whole person from a naturopathic perspective, and we'll hope you be here to join us.
105.9 FM and AM 630 WMAL.
And welcome back to Dr. Tom Roselle Live. We are live in studio talking about naturopathic medicine and what and how it can help you. We're going to address another principle right at the end of the show here, and it's probably the biggest one, is identifying and treating the cause, which is, the call out for all naturopaths out there. And really that's the key to any kind of health and wellness. And that doesn't happen overnight. So tell me a little bit about how we do that, and then why people are always wondering how long does it take, and when can I see changes and effects as well too?
Well, Stephanie, that's a great question. First of all, patient compliance varies from person to person. So someone who is vaguely familiar with a naturopath may not be quite as willing as someone who's quite desperate and has tried everything else. It's important to be willing to make lifestyle changes. In terms of the time factor, it's really one step at a time, and it varies. Sometimes there's immediate changes within 2 weeks. If someone has a food sensitivity and they're willing to eliminate that from their diet, they notice within 2 weeks that they're feeling better. Their mood's improved. They're not as fatigued. It's also important to meet the patient where they are at. So I can sit here and make, 5 different recommendations, but that might be too overwhelming. So I take it a step at a time to make sure that we're foundationally moving up the pyramid to achieve that optimal health. And what I'd like to add to that is in my own personal training, I was always interested in nutrition and wellness. So I started out as a certified nutritionist and was learning all about supplements and nutrition. And then there were vast amounts of certain supplements always being recommended. And I didn't feel comfortable with that because everything in excess can be toxic for any particular person or situation. So after my nutrition certification, after about 2 years, I said, no, that's it. I need to go find out much more about how the body works, how the physiology works, what's in the anatomy, the whole picture. So then I decided to go off to naturopathic school so that I could get the whole body system education, and then incorporate the nutritional wellness into a person's daily regimen and protocol. And I found that that has been most beneficial, knowing the physiology of the body and the individual biochemistry.
We know that, obviously as the demand starts to increase, and medicine is always changing. I mean, they're finding new sources, and we like to say that some of the things that we've always focused on, digestion, treating inflammation, treating adrenal stress, the fact that the liver has to detox the body, have been some of the basis of naturopathic medicine for hundreds of years, and they've just done it in different ways. And so when we can really bring that back and incorporate with Western medicine and show people that, the body is still the body that it was about 200-300 years ago. We didn't change that much. So let's try to apply some of these basic principles and then work up to more of the aggressive ones. That's, I think, one of the beauties of naturopathic medicine. And we have so many options. But yeah, it does get overwhelming, and that's why the training always is continuing as well, too. One of the last things, we want to give everybody resources. So, Sarah, I'm going to let you give some resources locally and nationally, so those of you that are listening online or the recording can also have some information for this.
Yes, for those looking to learn more about naturopathic medicine, the national resource would be American Association of Naturopathic Physicians. That's www.naturopathic.org. And locally here in Virginia, we have the Virginia Association of Naturopathic Physicians, and that is www.vaanp.org.
I want to thank Sarah and Patricia for coming in, and next week Dr. Roselle will be back in studio, and we'll be here to answer any questions you might have. Thank you for listening, and we hope to hear you next time.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Roselle Center for Healing reminds all women to conduct monthly and annual breast exams, and consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend concussions, sports injuries, and other injuries on Wednesday, August 10th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
Attend Ageless Health 2016, maximizing the fountain of your youth. Live without pain and finally restore your physical capacity. Join radio personality and author Dr. Tom Roselle, DC and guest speakers at Ageless Health 2016 on Thursday, October 13th at the Angelica Film Center, Mosaic in Fairfax, Virginia. Learn why Ageless Health is the most effective way to create a lifelong healthcare plan that will change your life forever. For event details and early bird registration, call 703-698-7117 or visit agelesshealth2016.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
you.